I'm Dr. Anthony Maloof. Thanks for watching this video on what happens after your Mohs Surgical Repair. One of the most important things that I do with Mohs Surgical Repair is to try and plan the repair for long-term outcome. If it looks wonderful day one, it's not going to look good month 3. So when you take your pad off, when you're instructed to do so, and we will tell you when to do that, firstly remember, take it off from the bottom up, not from the top down. It's very important. Next, you can certainly have a shower and clean around the wound. Water on the wound is not going to be a problem, so don't panic about that. Finally, you must use your ice packs. Ice packs are for swelling. So place the ice pack 10 minutes every hour over the wound to settle it down. You'll be given some antibiotic ointment. Please smear it on the wound. It's very important. And if you have any problems, let us know. But something that's critical is that you will be bruised and swollen, and even more than that, the wound won't look like what you want it to look like. And please, don't be alarmed if somebody tells you, oh my goodness, you look like Frankenstein. You're not Frankenstein. I have overcorrected you to make it so that when you settle into place, it's where we want to be. That overcorrection is critical. I can't tell you, you can't plan just to even imagine what it will look like. It will look different to what you expect, but it won't look perfect day one. That is completely normal, so don't worry about it. You can drive whenever you feel fit and well, and outside, use sunglasses. One thing that's very critical is how you sleep. Please do not sleep on that side. It's absolutely critical because that will change things, and please refrain from rubbing. If you have any problems, please call us. We will call you and tee up your appointment, and generally, just be patient. Wound healing takes months to settle down. Thanks for watching. I'll see you at your post-operative appointment.